Hello, everyone. My name is Dr. Peter Cashio, and I'm a board certified emergency medicine physician here in Austin and Dripping Springs. And I have over 20 years in medicine. I've taken care of probably 20,000 patients in my career. And 6 years ago, I started Code One Concierge Care, looking to actually practice integrative medicine and holistic care that uses science and actual systems analyst thinking to provide better outcomes. And today I'd actually like to talk to you about something that is near and dear to my heart, which is metabolic health in patients. It's something that I talk about all the time, and it is definitely something that is a passion because I have a lot of patients who come in thinking that they're healthy, and turns out that metabolic disease for a large number of them is actually the underlying cause for a lot of their illness. And the good news about metabolic health is that it is entirely reversible. Sometimes you need medicine, sometimes you don't, but it actually is 100% within your power to fix. And so I want to talk about what metabolic health is, try to demystify some of the things that we hear about or that you've heard about, and you kind of go through my framework for understanding metabolic health. Okay, so we're going to look at the screen here today, and these are all graphics that I've made up myself. And basically, the idea with this is to have an idea of how you think about it, right? And so you want to think about metabolic health as a balancing act, really, between healthy nutrition and strength building exercise. And that is the first thing that most of you will be surprised to hear. But yeah, you can think of metabolic health in large part as a condition that is due to not only your nutrition, but what you do with your muscles. Now, obviously, the real answer is a little bit more complicated than that, but really and truly, you can functionally get the same outcomes if you think of prediabetes metabolic health as something is that you can work on by increasing the engagement of your muscular system. That is really under your control. And so, really, what do I mean by nutrition? That's a loaded term, and in the United States, or at least other parts of the world, when you talk about nutrition, people will talk about it with a near religious fervor. And so, I'm not here to tell you there's one best way to eat, because for some people, there's a complete that it means different things. But in general, you want to avoid the standard American diet. What does that mean? That means reducing the levels of refined sugars and carbohydrates, and then having more than 10% of your food come from saturated fats. Now, I hear those of you who have heard of keto or carnivore screaming, yeah, that's a different case. But in general, if you're eating refined sugars and carbohydrates, and remember, carbohydrate is any kind of food that's not a fat and a protein. So if it's not fat and it's not protein, it's a carbohydrate. And the major problem that we in the West have is that our body takes in too many carbohydrates for what we actually need. Okay. The nutrition that I also, so yes, you can do modified keto or carnivore, but again, those are broad guidelines. It's not a holy religion. Okay. I also believe the standard American diet has a lot of whole food deficiency. So anything that is processed or in a bag, even a loaf of bread from the store, is considered processed food. Standard American diet and the bad nutrition is also worsened by alcohol, chronic daily stress, and the absence of moderate daily exercise. So, the thing I want to tell everyone is that when we talk about healing from metabolic disease, you're talking about taking months to a year or more to fix a problem that you've been dealing with for likely years or even decades. Okay. So, what is poor metabolic health? It's a kind of a vague term for most people, and they don't really understand what it means. It says, my metabolism slow, or is it fast, or what are we talking about here? And when a physician talks about metabolic health, what they're actually talking about is how does your body handle energy? Bottom line, okay? When you have too much energy input, i.e., you eat too much for the not for what you're outputting in terms of exercise, you're going to end up with eventually having metabolic dysfunction. That's been known by terms such as metabolic syndrome X, Insulin resistance is the newest one. Pre-diabetes, a lot of you have heard of that. And really that's all on a spectrum leading from, say, insulin resistance or early pre-diabetes all the way down to full-blown type 2 diabetes. And just, it needs to be said, type 2 diabetes is absolutely terrible. Okay. It destroys every part of your body and it does it rapidly. And those changes are often irreversible. So we don't want to get there. Okay, so we've talked about nutrition. Now let's talk about the second half of the equation, resistance exercise, the output. So your muscles are the third largest energy consumer in your body. Your brain, your heart are 1 and 2, and right behind it are muscles. And as opposed to the first two, all joking aside, your muscles are the things that you can do stuff about, right? You can do something about your muscles, okay? And so we have to understand the idea of glucose and insulin and how that works. But in general, glucose does not go right into the bloodstream. Okay. Glucose is in the bloodstream, but it doesn't go right into the cells, excuse me. And so what you have are these insulin receptors. Okay. It's a little gate, a door, if you will, right? And so your body makes insulin. Your pancreas specifically secretes insulin. And insulin says, okay, gate, I need you to open up so that you can get glucose into the cell. And for our model here, this is a skeletal muscle, okay? A skeletal muscle cell, biceps, chest, whatever you want to call it, right? And so when your body doesn't really engage in resistance or muscle stressing exercise, it doesn't need much. Your body doesn't need all that glucose. And your body will eventually start to make more and more insulin to lower your blood sugar. So it'll say, no, I don't need any glucose. That's fine. And your body hates having extra glucose. So what happens? Your pancreas secretes more insulin and it starts to overwhelm the receptor. Bam, you start getting that glucose being shoved into the cell. But because you're not using that muscle or your muscles, eventually the cell fights back and it says, no, I'm sorry. It's going to take more insulin to actually open the door to let the glucose in. And so you have this constant battle between your body producing lots of blood sugar from what you're eating and not using it, and the pancreas making insulin to say, hey, open that door, and the cells barricading the door saying, no, you can't come in. So it's like the big bad wolf and the 3 little pigs. And eventually the cells or the pigs win in this model because your body can only produce so much insulin, and then you become diabetic. And so now you have all this sugar floating around causing inflammation, causing damage to your eyes, your kidneys, your erectile function, just you name it, it's bad. Okay. So when I talk to my patients about being metabolically healthy, what I'm talking about is not only fixing their nutrition and improving the nutrition, but also getting them to get their muscles involved. Now, some of you will say, okay, doc, I'm not a bodybuilder. I've never been a bodybuilder, especially if you're a woman, you probably not have lifted weights that much, most of you. And you think, well, I can't get help. And the truth is you absolutely can. I don't care what you do. I don't care if you rock climb. I don't care if you do Pilates. As long as you're getting your muscles involved, if you're doing body weight squats, if you're picking up your kids and throwing them, or picking up sandbags or working on a farm, that's going to get your muscles involved and that's going to make you healthy. Okay. Our bodies are not meant to be sedentary. Our bodies love to move. Okay. So when you're thinking about metabolic health, you're asking how much basically glucose am I taking in or producing versus how much am I using? And you want them to be in balance. And when you have that balance, you're metabolically healthy. Okay. Okay. Why do you care? Why do we care about prediabetes, insulin resistance, metabolic health? We care because eventually, even prediabetes, but diabetes really accelerates it. But diabetes is an inflammatory condition that essentially destroys your body little by little. Okay. You get vastly increased risk of stroke and heart attack from plaque buildup in your arteries, not just in your heart, but all over your body. It will often cause kidney failure. And a lot of people, severe diabetics, who are people who've been diabetic for years and years, will often end up on dialysis. It can destroy your retina, called diabetic retinopathy, and that can lead to blindness. As a ER doc, I know this for sure. If you're diabetic and you get any kind of skin infection or other infection, your risk of a bloodborne, body-wide systemic infection, which is life-threatening, called sepsis, is much higher. I've seen several cases, unfortunately, of diabetics getting flesh-eating bacteria, and it literally eats their skin alive. And it's, if they survive, they're disfigured for the rest of their life. And a lot of people who have neuropathy, right? So diabetic neuropathy or peripheral neuropathy, like constant painful burning or pins and needles sensation in your feet and your hands. They often call it stocking gloves symptoms in medicine. So it's often this part of your hands or your lower legs from your shins on down to your feet. And it's painful. Imagine trying to live in that pain every day. And some of you may know people, or you yourself may be suffering from it. Okay. Men obviously can cause problems with erections, but it is actually completely reversible. Okay. So, first of all, most people who have prediabetes are eating what I call standard American diet, as we talked about. And there is a roadmap. And that roadmap is you start to address the deficiencies in your nutrition. Okay. And once we get the nutrition underway, then we start talking about limiting harmful factors like alcohol and stress. Stress can, believe it or not, raise your blood sugar level for sure. And then we start, I usually, it's not really linear, but I get people exercising. Just go for a walk, although that's not going to really help with prediabetes as much, right? Because we're talking about muscles. I just want you to get in the habit of being physically active. And then as we get you in moderate physical activity, as you start to, lift weights or do Pilates and you get used to using your muscles, you're going to really enjoy it. It's going to feel good and you're going to want to do it more. And then once we once we start to get a hold of things, then I encourage people to maintain vigilance. So we do that in part. We do check some blood work because you can't feel when you're pre-diabetic, most of you. And then once you get to a point where you're healthy, we work on getting you into a healthy lifestyle. A couple other terms real quick. So A1C, hemoglobin A1C, that is a term. So as your blood sugar, first of all, your red blood cells live 90 days, okay? And then they're recycled. So they go to the spleen, they get recycled, and the iron is extracted and saved for later. And then your bone marrow produces more red blood cells. So every 90 days, your red blood cells are being recycled. Now, as those red blood cells are cruising through the bloodstream, they are interacting, and there's blood sugar in the blood, right? And depending on what your level of blood sugar is, whether you're eaten or not eaten, fasted or non-fasted, some percentage of that glucose will stick to these red blood cells. So if you've ever seen a doctor telling you that they're really worried because you have an A1C of 5.7%, that means that 5.7% of your red blood cells had sugar attached to them. And that means that your average blood sugar was 117. Okay. This is your fed and fasted. So this is just 24/7, 90 days record of blood sugar. The important thing to remember here is that A1C is what I call a lagging indicator. It doesn't tell you where you are today. It tells you basically where you've been. If you want to get really technical, not all your blood is 90 days, but some part of your blood is less than 30 days. Another portion of your blood 60 days old, and another portion is reaching the end of 90 days. So it tells you basically where you've been for 3 months, right? And that's great, but that is not the whole story. The next thing we would talk about is an insulin resistance score. So let's go up here. We're going to way up here. This is just what I get all my patients get when they get their lab work. It lays everything out in a story time. Okay. So when I check your blood sugar and I check your metabolic health, I'm checking 4 factors. Okay. Hemoglobin A1C tells me where you've been. Your glucose, or your average blood sugar, fasted, like what your fasting blood sugar was. What's your insulin? What was your insulin? How much insulin was present in your blood with that glucose? And what you do is you multiply fasting blood sugar times insulin, and you divide it by a cofactor or a constant, 405, and that gives you an insulin resistance score. Okay. And that insulin resistance score will tell you where you are health-wise. Okay. So exceptionally metabolically healthy people have an insulin resistance score of less than 1. I consider it generally optimal if you're between anything less than 1.5. When you get to 1.5 to 1.9, that's what I call borderline, because you're creeping up on early prediabetes. And believe me, I've heard patients complain saying, God, doctor said I have a pre-diabetes, and they think that we're making things up. But what we're really doing is we're saying, hey, we're noticing a pattern. And if you get on top of it quickly, you can prevent things from getting worse. Anyway, when this calculation, insulin times glucose divided by 405, gets a 2.0 to 2.9, you're now in early prediabetes. And now your body's not working as well, right? You're starting to be more inflamed. Your joints probably hurt. You're at greater risk for developing heart disease and plaque. And so we really don't want to do that. Severe diabetes is anything from 2.9 to 10. Yeah, I know it's a big range, but when you're in the severely pre-diabetic range, that's specifically when you're looking at some sort of medication. You pretty much have to be on medication, at least at some point. And then obviously diabetics, you need to be on medication. And just here, these are some of the medication combinations that we can use to help lower blood sugar. Okay, so that's what that means. So now going all the way back. Okay, so how do we fix it? I get this a lot. Okay, Dr. Cashio, you tell me I have prediabetes or severe prediabetes or God, I'm almost diabetic. What do I do? And I've come up with a roadmap. This is my actual roadmap, right? And so you have to understand the problem, okay? And then we come up with a plan, okay? And then we start saying, the first thing I do is I tell everyone, unless I tell you otherwise, you start with a carb goal of less than 100 grams per day. And most of you who've never carb restricted before, this will feel like you're dying, but you're not. You're functioning just fine. This is not considered ketosis or even carnivore. It is just, we're restricting the carbs that you're taking. That's bread, rice, crackers, hummus. I'm telling you, you eat way more carbs. And also, parenthetically, carbs are easy and cheap to produce in factories and in modern food production. So carbs are always going to be cheap. It's protein and fat that are going to be more expensive. And so usually if you've got cheap food, it's really not, it's mostly high in carbs and there's very little protein or fat. Okay, so we're going to restrict your carbs to less than 100 grams as a guide to start. And then we're going to start daily physical activity. We want you to work those muscles, okay? And we're going to have you get enough sleep. Sleep is one of the foundational tenets of being healthy. If you don't get enough sleep, right off the bat, your cortisol is going to be elevated. You're going to have more stress hormones. Your body's going to be in a higher state of fight or flight. You're going to have higher fasting blood sugar. You're going to have higher blood pressure. It's just not good. And it's not meant to be a 24/7. Now, pre-civilization, would humans always be in some level of poor sleep or high stress level? Maybe, but I think humans were very much like you feed, you hunt, gather food, you feed the family, you do some work, you rest, you relax, and then you do the next thing. Okay, humans anthropologically, I think it's fair to say that human beings pre-civilization were pretty much burst workers, right? Which means you'd work really hard for a short period of time and then you'd rest. Okay, but now with the modern world or civilization, if you will, although it has a lot of great benefits, a lot of people don't sleep. And it's funny because human beings are the only species on earth that willingly shorts its sleep. And there's a lot of reasons why we do it. That's a topic for another day, but this is actually one of the more harmful things that we do to ourselves. Okay, and it can be tough. I know there's a lot going on, but sleep is super important. All right, we talked about medication, as I said earlier. Depending on how severe you are when we run across each other, I give people a chance to do it with old-fashioned way of just doing nutrition and exercise. Sometimes people do need help. And depending on your situation, your mileage may vary. You can talk to your own doctor about it. Maybe a short-term trial of a medication is not a bad idea, especially if you're morbidly obese, you cannot control your appetite, you don't exercise, and you don't sleep. You have a lot of things going against you. And I tell people, look, just try for 3 months. Just try for 6 months. You're trying to get yourself out of the hole. If you were stuck in a 12-foot hole in the ground, would you say, if I stood on the top of the pit and said, hey man, get yourself out of there, you got this, it's not going to be very helpful. Now, if you're in a 3-foot hole, you can probably climb out yourself, right? But that deeper that pit, the more I need to put a ladder down or you throw you a rope. And so think of medication in most cases as I'm giving you help out of that deep pit. And once you get beyond that, there's a really good chance you won't need to be on it again, okay? And then this is the key right here. Be accountable and track progress. So we do accountability here in my clinic because I recognize how important it is, because I'm a Marine, I know how it is. But I always encourage people to find a group of people or someone other than their spouse who they can be accountable to, because human beings, we're social creatures. We do well when we're in a social group, and the opinions of others matter, right? And so if you're around people who are like, oh, it's okay for you being fat, I don't care, that's not going to help you. But if you're around other people who are of a similar mind as you and they want to be healthy, that's going to motivate you on the days even when you don't want to do it. Okay. So 7 steps to optimal health: understand the problem, nutrition, consider medication, exercise and movement, sleep, stress, social accountability. Okay. So, nutrition, we're going to not spend a ton of time. I don't want to bore you, but generally speaking, and this is the reality, ketogenic and carnivore diets are excellent, excellent tools for reversing prediabetes, even diabetes. They're phenomenal. And I know there's guys like Dr. Sean Baker and others who are proponents of it, but the reality is that most of my patients, in my experience, doing this 6+ years, the reality is very few people can actually maintain carnivore in their life. Either they don't want to, or they have little kids and it's difficult, right? They don't live in a hermetic bubble that where they can control their environment. And so if you have other options and comments, and if you want to leave a comment in the video, that'd be great. I'm always looking for people who've managed to figure it out. In 6 years, I haven't seen too many of my patients that are able to actually maintain it. Okay. I will say, if you can get that carb load less than 100 grams per day, you're going to do really well. And then once people get there, and if they don't want to continue with a keto or carnivore, I say, look, do a Mediterranean diet or keto with a lot of vegetables. Some people do well with a vegan diet. I tried vegan nutrition for 6 months. I was always hungry, but I felt amazing. But ultimately, I wasn't getting enough protein. So that's another story. But the point is that you want to think about something that you can actually do and that's sustainable, right? It's something that you like, it's sustainable, it's easy, and it's something that's portable. So if you need 40 different supplements plus your element and your protein powders in order to maintain this low carb diet, that's not sustainable. That's not going to last more than a few months. You're going to fall off. You're going to want to have drinks with your wife, or you're going to want to do something fun with your kids, and poof, it's gone, right? And for just FYI, if you've ever done keto or carnivore, sometimes people have been low carb for a while, but they were previously addicted to carbs, they'll find that the second they have carbs again, it's like being addicted to heroin. They really want it again. And fun fact, carbohydrates actually activate the part of the brain that codes for addiction, that controls addiction. That's the nucleus accumbens. So really, carbohydrates are literally addictive. Okay. Okay. Next step is nutrition or medication assistance. This is where I give people the option. Sometimes I say metformin. This is a good blood sugar lowering medication. Another excellent option are the GLP-1s, the semaglutide and tirzepatide. You need to be doing this under a doctor's guidance. Please don't get some random internet doctor who's, yeah, sure, or nurse practitioner to do it. They don't really track you and they really don't care. And these medications can have some pretty significant side effects. And that's why they should always be done under the guidance of a physician, preferably your physician. They can start you low and deal with the side effects like nausea and vomiting. Okay. And then I'll talk about exercise and moving. Okay. So cardio is not going to move the needle in terms of it's going to move the needle a little bit in terms of your insulin resistance, if you are insulin resistant or pre-diabetic or diabetic, but it's going to help your overall cardiovascular capacity. It's going to lower your stress level. Your body was meant to move. We are not meant to sit. And so cardio, even if it's just walking, is amazing. It feels great. And then resistance exercise. Resistance, again, your body is meant, it loves it. It responds positively to lifting weights. And again, people don't need to overthink this. Even though I'm a gym bro, I don't expect anybody else to be a gym bro. Do what you can do, make it fun. If you travel a lot, I get a lot of my patients, they're traveling for work. And I say, if you're traveling and you're in a hotel, you can always do push-ups, or you can do body weight squats, or you can do wall squats where you sit against the wall and your legs at a 90-degree angle. You've got options, right? So it's only if you decide that you don't want to do it that you don't have options, right? But even the crummiest, whatever hotel, unless you're like a Motel 6, But even then, most of them have at least a little something. And I don't care if you're normally a big, strong guy who normally curls like 75-pound dumbbells. Fine. All they have are 25. So when you're going to do triple the number of reps that you're doing, there's no excuse. But just get your body going and it makes you feel good. Okay. No matter what your shape is, it feels good. And I will tell you, there's a guy in my clinic who's in his early 30s. He hasn't lifted since he was like for over a decade, got out of shape, wasn't feeling great. And what do you know? He's starting to lift weights and boy, he loves it. It feels great. So why wouldn't you do it? Okay. Next, we're going to talk about sleep. And this is key. If you're not getting restorative sleep, all of your efforts will either fail or produce less than amazing results. You do need to recover during sleep. Anyway, we just found out that there is a system in the brain that is a type of lymphatic system in the brain that it's only effective when you're sleeping, that it cleans out a lot of the toxic metabolites that your brain produces throughout the day. So you're literally flushing out your brain of all the bad stuff. But also, when you don't sleep well, cortisol spikes, and cortisol makes the hunger hormone, ghrelin, very active. And so usually when people sleep poorly, not only are they irritable, not only do they require a lot of caffeine, which starts to mess with their sleep-wake cycle, but now you're overproducing ghrelin, and now you have less control over what you eat because you're just hungry, even though you're not actually literally hungry, but your brain thinks it is. Okay. And then I always tell people to have good sleep hygiene, consistent bedtimes. Don't do white light at night. Usually by the time you hit 6 or 7 at night, even here in Texas, I tell people make sure that you start lowering your lights. And definitely don't have any screens of any sort in your bedroom because your brain is smart. And if it goes in the bedroom and it sees that there's no screens, it knows that it's time to sleep or to talk to your spouse or whatever. And your brain is going to calm down. But if you screens or TV and you're doing all that, you're not going to calm down. If you're going to watch TV before bed, that's fine. Do it in the living room and then go to bed. Okay. And then don't use alcohol, caffeine, or any kind of stimulant use in the afternoon. Okay. And then I recommend this link. I have the link below for this really nice video by Andrew Huberman. He talks about sleep. It's an animated short. Someone made it with his overlaying his voice. Very good. And there's another video that debunks 10 different sleep myths. Okay. Lower the bad stress level. So sleep, get good sleep, nutrition, that actually helps. Exercise also helps. Spiritual prayer, if that's your thing, meditation or mindfulness. I actually think that this is more important than people want to give credit for, but it's very important. Yoga is another one. I do yoga, love it. And then mental health. If you're struggling, please talk about it with someone, right? Because when people are depressed or sad or worse, they don't care about their health. They just don't. And so all of this is just performative. It doesn't matter. And so whether you're a man or a woman, I hope that you'll talk to someone. And guys, you don't necessarily need a therapist. Just tell me about your mother and has you laying on the couch and telling me about all your childhood trauma, unless that's appropriate. But you do want to find a counselor who can zero in on what's going on and nail what you're doing. And you know that if they're doing a good job, you're going to get mad probably because you might get upset because you're like, wait a minute, I'm not like that. But it turns out that it's probably right. So guys, it's okay to talk to someone who gets it, who can give you focused advice, who is giving you homework to do. That's a sign of a good counselor, that here's your homework. Here's what I actually want you to do. And just like you wouldn't expect to get strong without going to the gym, you can't expect to get mentally healthy without putting in the work in. And it takes time, but the payoff is excellent. Excellent for yourself, for your wife, for your kids if you have them, because your kids are watching and you can pass on trauma to them very easily. Did you know PTSD and emotional trauma can be passed on but generation by generation? Even if the kids themselves never experienced the trauma that you went through, your behavior, guys and ladies, can actually cause the same sort of trauma reaction in your children that you're feeling. And they'll carry that into adulthood and then potentially pass it on to your grandchildren. So just a word to the wise. Okay, we're wrapping up here. I will say that social accountability is super important. Humans were naturally social, and we also want to be around people who get us and support us. If you have anybody in your life who's a negative Nancy or is constantly down, do your best to limit your exposure to them. I have had friends in the past that I love them dearly, but they're like a vortex of hate and discontent. And if you spend any time around them, you're eventually going to feel that, because my God, why wouldn't you? I tend to believe in surrounding yourself not with everything's great and rainbows and unicorns, but the gift of life is the gift of life. Okay. We're on this planet for our allotted time and not a day beyond. And we might as well enjoy it as much as we can, because it's hard. It's hard being a human being. And some of us have had worse times than others, but you love it, right? Viktor Frankl was in a Nazi concentration camp. And he talked about the joy of life in a concentration camp. So I think it's Viktor Frankl, Man's Search for Meaning. So point is, limit the negative stuff. Horror movies, forget about it. You don't need to see that stuff. Life's rough enough as it is. And then accountability, right? So a gym group, personal training coaches, group workouts. A lot of you ladies like Orange Theory, Camp Gladiator's another one. We have one at Code One that we're working on as well. Social media, I think it can be good if you want to publicly announce your goals and document your progress. If social media is a negative in your life, get rid of it. You really don't need it, and you probably won't miss it. And then document. If you can look back where you were, you can see what progress you've made. If you don't track your calories in, calories out, your workouts, photos, how are you going to know if you're improving, right? So at Code One, I bought an in-body machine last year, 570. Love that thing, because our perceptions are crummy, right? We're not good at perceiving certain things. And I've had patient after patient like, oh, the scale's not moving. I feel terrible. I'm doing all the things. And then you see that they've lost 10 pounds of fat, but also gained 10 pounds of muscle. So yeah, no wonder the scale didn't move, but you're fundamentally a different person now, under the hood, if you will. And so you want to document that stuff, talk to people, figure it out. I've heard of the Hume, scales. Don't know if they're accurate yet. We're going to be running that test with one of my patients soon. But whatever you do, make it document in the same way, at the same time, and just be consistent. Okay. And then lastly, real quick, chronic stress does cause high blood sugar in otherwise insulin sensitive or healthy patient, right? So here's where it goes. Let's say stress hormone release includes glucose production, right? If the tiger's coming after you, you need extra energy. Okay. And then that's going to reduce the amount of insulin effectiveness. Remember, you're dumping sugar into the bloodstream. The cells are like, I don't need all this extra blood sugar. And so it's going to take more insulin. That leads to a blood sugar elevation. Your appetite increases because as your blood sugar goes up, and then you start to get these metabolic issues. And that is a stressor in itself, and the cycle continues. And there's the reference if you like. Anyway, I hope you found this video helpful and informative. I'd love your feedback to how to improve this. But this is what I tell my patients. This is how you think about metabolic health. This is the foundation, right? If you can understand metabolic health, you're going to be 75% of the way where you need to be in terms of understanding overall health. This right here is the baseline. This right here will help you make some really good choices and help you understand cholesterol, hormone levels, everything, kidney function. It's all related. So let me know if you have any questions. I'm going to try and put as many resources as I have in here in the description. Thanks for listening.